How to get CPR certification. If you are planning on being a lifeguard, babysitter, or just want to be useful in an emergency, you will need training in CPR. You will need a computer with internet access, a gym or municipal swimming pool, and classes. Step 1. Search the internet for online courses or classes in your area. The Red Cross and the American Heart Association websites allow you to search for classes by zip code. Step 2. Call your local gym or municipal swimming pool. They may offer CPR courses that you can take. Step 3. Register for the course that is most convenient for you. Attend the CPR classes and practice as instructed. Step 4. Pass the test required by CPR classes at the end of your instruction period. Make sure you get enough practice. Step 5. Accept your certification card from the instructor or supply the online course with your mailing information for the card to be sent to you. Blow, blow, push, and repeat. Did you know? Cardiopulmonary resuscitation, or CPR, was developed by surgeon and medical innovator Peter Safar in the 1960s. Up until then, cardiac arrest almost always meant death.
How to deal with a knocked-out tooth. A childhood visit from the tooth fairy is one thing, but having a permanent tooth knocked out is another, distinctly less enjoyable affair. Act fast, and it could be a temporary one. You will need sterile gauze pads, a cup, and water. Optional, a moistened tea bag and whole milk. Step 1. Find your tooth, or piece of tooth, as quickly as possible. Step 2. Pick it up by the tip only, not the roots. Step 3. Apply sterile gauze to the socket where the tooth was knocked out to staunch the bleeding. Step 4. Gently rinse the tooth in a cup of water. Move fast. A dentist has the best chance of reimplanting a tooth within 30 minutes. Don't try to wipe the tooth clean or hold it under running water. Step 5. Place the tooth back into its socket. Do this for adults only. Children may swallow the tooth. Step 6. Place a gauze pad or a moistened tea bag over the tooth between the bottom and upper teeth and very gently close your mouth to hold it in place. If you are unable to place the tooth back into the socket, submerge it in a cup of whole milk or your own saliva, not water, until you can get to the dentist. Transporting the tooth dry can cause permanent nerve damage to the tooth within a few minutes. Step 7. Seek emergency care immediately. If you cannot get to a dentist right away, go to a hospital emergency room, and don't forget the tooth. Did you know? No one's sure exactly how the tooth fairy myth started, but its modern version, a fairy that replaces a shed baby tooth under a pillow with money or candy, didn't show up until the early 1900s.
How to handle alcohol poisoning. Alcohol poisoning can be fatal if left untreated. Find out what to do if you suspect someone has alcohol poisoning. You will need emergency help, company, posture, loose clothing, unobstructed airways, and CPR. Don't drink unless you're of legal age. Drink responsibly and never drink and drive. Step 1. Call 911 immediately if you suspect someone is suffering from alcohol poisoning. Alcohol depresses the central nervous system. If someone has been drinking heavily and loses consciousness, get emergency help. Alcohol poisoning symptoms include slow and shallow breathing, a slow pulse rate, and cold, clammy skin that appears pale or bluish. Step 2. Stay with the person. Never leave an unconscious person suffering from alcohol poisoning alone. Alcohol poisoning impairs a person's gag reflex and they could choke on their own vomit or inhale vomit into their lungs. Step 3. Roll or push the sufferer to their side and bend their knees. This posture can help prevent choking, which is of special concern if the person vomits. Step 4. Loosen the clothing around the person's neck and chest to allow them to breathe freely. Closely monitor the person's breathing. Step 5. Check the person's mouth for potential obstructions to easy breathing. People suffering from alcohol poisoning already have difficulty breathing, and further complications can result in death. Step 6. Perform CPR on the victim if their breathing stops or if you can't find a pulse. Always drink in moderation so you don't suffer alcohol poisoning. Did you know? Prohibition in the United States began at midnight on January 16, 1920.
How to make a butterfly bandage. A butterfly bandage is a handy item when a wound has smooth edges. It brings the edges of skin together and thus speeds up the healing. You will need scissors, adhesive tape. Step 1. Cut off a piece of tape that is about 1 inch in length. Step 2. Fold the piece of tape in half so that the non-sticky sides are against one another. Step 3. Cut a small triangular notch on one side of the tape, beginning about 1/4 of the way down from the folded edge and cut angling up toward, but not all the way to, the center of the folded edge. Step 4. Repeat on the other side, cutting a triangular notch that matches the one you just cut. Step 5. Unfold the tape so the sticky side is facing up. The tape should look like it has a bow tie shape in the middle. Step 6. Fold the center flaps across the middle of tape, sticky side in, so they overlap. This will prevent the adhesive from sitting directly on top of the wound. Step 7. Apply the bandage by sticking one end of the tape on one side of the wound, gently holding the edges of the wound together, pulling the tape across the wound, and sticking its other end in place. The narrow middle of the tape should be positioned over the edges of the wound. Step 8. If the wound is long, make and apply as many butterfly bandages as needed along its length. Did you know? The wings of butterflies and moths are actually transparent. How to make a sling. Making a sling is a simple procedure, and it's very handy to immobilize an injured shoulder, arm, or collarbone. You will need a large piece of cloth, scissors, a long, thin piece of cloth. Optional, a long-sleeve shirt or sweater. Step 1. Cut a large piece of cloth into a square that's at least 40 inches on each side. If necessary, dress any wounds or make a splint before putting the arm in a sling. Step 2. Fold the cloth diagonally in half, forming a triangle. Step 3. Drape the triangle so its base runs up and down the chest opposite the injured side, with the top corner dangling over and behind the shoulder on the uninjured side and the bottom corner hanging below the waist. The corner opposite the base should wrap partway around the waist, lying between the torso and the injured arm's elbow. Step 4. Gently support the injured arm at the elbow across the torso. Step 5. Lift the bottom corner up so the sling now cradles the injured arm. The hand should extend just past the base of the triangle, and the elbow should be supported by the corner that's opposite the base. Drape that same corner you just lifted over and behind the shoulder above the injured arm. Step 6. Tie the two corners that are behind either shoulder to each other so they loop behind the neck, adjusting the knot so the elbow is bent at a right angle, not drooping low or pulled too high. If you don't have a piece of cloth available, you can use a long-sleeve shirt or sweater. Simply tie the sleeves together behind the neck and anchor the arm with the body of the shirt. Step 7. To further immobilize the arm, wrap a long, thin piece of cloth around the body to keep the arm securely against the body. Did you know? After his arm was shattered in a car accident, legendary guitarist Les Paul instructed surgeons to set his arm at an angle, allowing him to continue to play.
How to perform the Heimlich maneuver, abdominal thrusts. Abdominal thrusts, also known as the Heimlich maneuver, can be used to expel a foreign object lodged in a choking victim's windpipe. You will need someone to call 911 and firm resolve. Never practice the Heimlich maneuver on an infant under a year old or on a person who is not choking. You could cause serious injury. Step 1. Confirm the victim is choking. If they are coughing, they are not choking yet, so encourage them to continue. Signs of choking include the universal hand sign of clutching one's hands to the throat, the inability to cough or speak, labored or noisy breathing, bluish skin, lips, and nails, and loss of consciousness. Don't slap a coughing person on the back. It doesn't help and can make them start to choke. Step 2. Once you determine the person is choking, act quickly but calmly. First, send someone to call 911. Step 3. Help the victim stand if they're not already on their feet, and stand behind them with your chest to their back. Step 4. Wrap your arms around the victim's torso, making a fist with your dominant hand, and center it against the victim's upper abdomen, thumb inward, above the navel and below the ribcage. With your other hand, cover your fist for support. If you cannot reach your arms around their abdomen, or if the victim is pregnant, compress their chest between the breasts at the breastbone. Make firm backward thrusts. Step 5. Quickly thrust inward and slightly upward with your fist, as if you're trying to lift the victim off their feet, causing air to rush out of their lungs.
Don't squeeze the rib cage as you thrust upward, otherwise you could break a bone. Step 6. Repeat the thrusts until the object dislodges or the victim loses consciousness. Step 7. If the object does not come free and the victim loses consciousness, proceed with CPR until EMTs arrive. Step 8. To perform the Heimlich maneuver on yourself, lean your upper abdomen over a hard horizontal surface, such as a railing or the back of a chair, and use it to deliver strong upward thrusts. Did you know? Besides inventing the famous abdominal maneuver, Dr. Henry Heimlich also invented a chest valve that saved thousands of wounded soldiers in Vietnam.
How to recognize and treat common sports injuries. Mild sprains or strains are among the most common sports injuries. In most cases, you can treat these conditions at home using the following guidelines. You will need rest, crutches, a sling, an ice pack, a damp towel, an elastic bandage, and pillows. Optional, anti-inflammatory pain relievers. See a doctor if putting weight on the injured area causes severe pain or buckling of a limb, if lumps other than swelling appear, if the injured area becomes very tender to the touch, if you are unable to move an injured joint or muscle, if the injured area becomes numb, or if redness or red streaks begin spreading out from the injury. Step 1. When treating a mild sprain or strain due to a sports injury, remember the acronym RICE, which stands for Rest, Ice, Compression, and Elevation. Strains and sprains occur when you stretch a muscle tissue or tendon. Strains usually occur in the neck, back, thigh, and calf muscles. Sprains occur at joints. Step 2. Rest the injured part of your body and avoid using it as much as possible for 1 to 2 days. Use crutches or a sling to keep the weight off an injured leg, arm, or shoulder. Take anti-inflammatory pain relievers. Step 3. Apply an ice pack to the injured area and cover the ice pack with a damp towel to prevent frostbite. Apply it to the injured area for 10 to 15 minutes at a time, 3 or more times a day for the first few days. Step 4. Compress the injured area. Wrap an elastic bandage around the area, starting below the joint, taking care not to cut off the circulation. Step 5. Elevate the injured area above the level of your heart. Rest it on pillows when you're sitting or lying down to keep excess fluid from accumulating. Did you know? New research suggests that weak muscles may cause the painful and debilitating condition known as runner's knee.
How to treat a cat bite. If a frisky kitty has sunk their fangs into a family member, this guide will show you how to treat that wound and avoid the dreaded cat scratch fever. You will need soap, warm water, an antiseptic, antibiotic ointment, and gauze. Optional, a doctor. Step 1. Wash the wound immediately with soap and warm water. Scrub the area for several minutes to remove saliva and bacteria from the cat bite. Don't scrub too hard, but be thorough. While it may be painful, an infection is even worse. Step 2. Rinse all the soap from the wound and then follow with a good antiseptic such as iodine or hydrogen peroxide. Step 3. Apply firm pressure to the puncture marks from the cat's teeth to stop any bleeding. Keep the wound elevated to prevent the wound from swelling. Step 4. Cover the bite with an antibiotic ointment and then wrap it in clean gauze once the bleeding is stopped. Apply clean bandages at least twice a day until the healing starts. A tetanus booster or rabies vaccine may be needed if the animal is a stray. Animal bites in humans can be deadly. Step 5. See a doctor if things get worse. Have a baby or small child checked out, even if the bite is minor. Swift action will make any pet bite less traumatic and painful. Did you know? Cat scratch disease, or CSD, is caused by a common bacteria which 40% of all cats carry at some point in their life.